Good morning, everybody, and welcome to our session on families and homelessness. We're really thrilled that everybody's come together. We have an amazing group of family providers here today to talk about family homelessness and what they're seeing out in the community and in the shelters as they're working so hard to help families during this really difficult time. I want to welcome all of you to the Housing Equals Justice 18th Annual Institute and Conference. I'm Madeline Ravish from the Connecticut Coalition to End Homelessness, and this has been an amazing conference so far, so hope that everybody out there is taking advantage of it and spreading the word to others about it. A few words about Housing Equals Justice. We shaped this whole conference around the themes of criminal justice, racial justice, and economic justice, which are three threads that we see running through the work that many of our providers are doing out there around ending homelessness and their issues that we wanted to bring to the fore through our Housing Equals Justice campaign. So we're really thrilled that so many people, over 1,000 people, have registered to be part of this conference, which has had amazing sessions. We have some amazing panels on everything from how COVID is affecting work around ending homelessness to families and youth to pets today. At 3 o'clock, we've got an amazing lunchtime panel discussion called Crisis in the Rental Market with Zillow, speaking about what they're learning about what they're seeing in terms of economic trends. So very exciting. And please spread the word. Up here you see our hashtag ATI 2020, as well as who we are on Facebook, Twitter, and Instagram. So please help us tell the world that housing equals justice and encourage people to register. Also, 4 o'clock today, there's a happy hour and there's a surprise. So try to make it, I think it's going to be fun. So, and of course, I want to thank our sponsors, including Bank of America and Zillow, who are presenting sponsors who've made this whole conference possible and made it possible for us to offer this conference to you free of charge. We love that so many people have been able to attend, thanks to Bank of America and Zillow. And today's workshop sponsor is CCADV, and I'm pleased to welcome Annie Stockton from CCADV, who's going to come up on the stage and say a few words about CCADV and why it just made so much sense for them to sponsor this panel.
Hi everyone, thanks Madeline. It is great to be here. I'm Annie Stockton. I am the Director of Housing Advocacy at the Connecticut Coalition Against Domestic Violence. So we are Connecticut's statewide domestic violence coalition, just like our name says. And I'm very excited to be sponsoring this workshop, especially. Domestic violence is the leading cause of homelessness for women and children, and it's so important that we are a part of this and we're working together. I'm very excited to say that over the past year, CCADV started a rapid rehousing program, and we were able to successfully rapidly rehouse 102 families in our first year of the project. And I mean, the success of that is really due to the phenomenal work of the advocates we have working in the DV system, but it also has so much to do with the collaboration and the continued work that we do together with CCEH and all of our housing and homeless providers. Connecticut is really one of the first states that was able to integrate full coordinated entry with the DV system. So that really was the first step into us working with the homeless system and being able to implement this rapid rehousing program. So the work we do is so important, or the work you do is so important to make the work we do important. And I'm so glad that we're able to sponsor this, and I'm glad we're able to be a part of this conference.
And with that, I want to turn it over. Thank you so much, Annie. We're so thrilled to have you here too. So that means so much. And now over to Diana Berube from CCH, who's going to lead this discussion, and welcome all of our panelists who have joined. And thank you to all of our panelists and everybody here. So thank you.
Thanks, Madeline. So on the webinar this morning, we've got some really great experts in the field, people that are working with families that are experiencing homelessness. And I think it's really great to note, and really important to note, that the word homeless can mean a lot of different things. It can mean that a family is literally out on the street and needing to enter an emergency shelter, or it can mean that a family is struggling with a housing crisis and maybe what we call doubled up, working through couch surfing or trying to stay with family and friends and utilizing their natural supports. So the folks that we have on the call this morning are people that work directly with families to try to help them come up with other solutions instead of entering an emergency shelter. And they might also be case managers at a shelter who are working to help families find stable housing. So the first question that I'd like to pose to the group, and this is a roundtable discussion, so please feel free to answer accordingly. The first question that I'd like to pose to the group is, in that couch surfing kind of situation, during a pandemic that might be a little bit more difficult for family or friends to accept someone into their home, what are the difficulties that we're seeing in those doubled up situations?
Some difficulties that families are facing while being doubled up or couch surfing with the family member or friends is the risk of jeopardizing their lease. You know, there are times that if you put a family or with the family member or friends, you have that risk the neighbor finds out or complains to the landlord, will they get evicted? We try to put them with family or support system during this time because it's safer to be, they've been with them for days, weeks, they've made a bubble for themselves, they have isolated, they're keeping themselves safe, plus people around them safe, and they can keep their kids safe as well. They're with someone safe. They're not in a hotel, they're not in a shelter, they're somewhere where they can trust. And that's one thing that's good about doubled up, but putting them there, you have that risk of, you know, if I stay too long, you know, weeks, months, however long it is, will I jeopardize their lease? And that's one issue that we face as well.
Mm-hmm. And just to kind of piggyback off of that, just some families are utilizing some of the hotels for a couple of days just to kind of break up that time that they're spending in families' home, because there is a huge fear about the lease and the landlord kind of finding out. But also there's some family members that are worried about being exposed to COVID, you know, so there's a lot of kind of pushback in that way. So sometimes families are utilizing hotel space just to kind of, you know, kind of break up the time that they're in the home as well. So it's kind of like a combination of both.
So we're seeing families that are utilizing hotels instead of emergency shelter, bouncing back and forth.
Yeah. Between
Hi.
families and hotels, just to kind of break up that stay in the homes if families are, or the homeowners are worried about their lease or their landlord finding out that they're there. Yeah.
And what I've seen is a lot of abuse going on, staying with family, the family's asking for ungodly things, money from the client to do things that they normally wouldn't do. So it's becoming very abusive being in that household, whether it's verbal, financial, and they're scared because, you know, again, COVID, where else are you going to go? And you're supposed to be safe when you're with your family, but, you know, family is also abusive. So we've seen a lot of that people want to come back to shelter due to that.
Because of the conditions that the family is posing to house them.
Yes.
Yeah.
I also wanted, can you all hear me? I just also wanted to add, also sometimes it has to do too with the conditions of the home themselves. Sometimes they do go to stay with family and friends, but not really knowing the conditions of the home until they actually get there, where there could be, for example, some, you know, bug infestation or whatever the case may be, that is also putting them in a position where they might have to come out, even though they are doubled up. They might have to come out from that situation into a hotel, and they might not necessarily have the means to be able to stay there long-term either, because of financial issues, where again, they might probably be looking into the best situation for them would be to come into a shelter.
Thank you, Jessica. So entering shelter might not mean that they don't have natural supports. It's that the natural supports home that they could go and stay in is an unhealthy situation, not just behavioral, but maybe infestation or things like that.
Absolutely. So that's where we have to work, you know, as a partnership, we have to work with the residents, the clients actually, to be able to find all options, all solutions that we can because as we know, shelter sometimes might be the best place, but really should be like the last
resort.
we really want to explore all options first. Also diversion being very critical, with the calling of the 211 and actually setting up an appointment for that diversion conversation. But unfortunately things do happen where they will have to come into shelter, but we want to explore all avenues before that actually becomes the solution.
Right.
I'd like to add, we also see within the DV system, not just, there's definitely violence that will bubble up when people are doubled up and, no one wants to be crammed into the same space and have a bunch more people in their apartment than they should. But in the DV system, as much as we try to divert, we also have situations where someone might want to stay with family and the family might want to take them in, but because of safety issues, if someone has to flee as, because they're being abused, they may not be able to go to their mothers or their cousins because of the fear that that abuse might follow them to wherever they're staying. So it becomes a conversation of not just, if we put you here, is this a safe place for you, but are you putting other people in danger if you stay with them?
Thank you, Annie. Yeah, I think pre-pandemic, what we saw a lot of was friends and family want to be able to help out. They love their loved ones. They want to be able to support them, but maybe they have their own public housing situation. And so a landlord has strict rules and guidelines that they have to follow, and being that they can't stay longer than 2 weeks. And that causes that kind of couch surfing situation. During this health crisis, though, there's an added layer of not being able to stay with family or friends, maybe because you're working outside the home and you're coming into contact with lots of other people. And so that poses that additional risk of health and safety, people being a little bit more nervous about catching COVID. And is that something that all of you are seeing in the field, in talking with families that are trying to help?
So I have seen it, especially when kids started to go back to school. I had a lot of families who maybe could no longer stay, or the family member where they were staying kind of wanted to push them out because they fear that, the kid or their kids would bring back COVID if they went to school. And it just became an issue for a lot of families I saw, especially with kids returning back to school, that fear that it might be spreading all over again.
Hi, Diana. Hi. Someone put a question, which I thought was a really good question, in about families that are doubled up. Does everyone see the question, or do you? Someone named Elaine. I think there's a question also for you, Annie, in here too. And I can answer that question. It just said, I find that families that are doubled up sometimes do not get as much support or case manager because they're not in the shelter, especially for students who are struggling and would benefit from the extra support. So those families that we did put with other families or put in the hotel, stay with friends, wherever they still receive the case management from Spooner House, wherever they were. They were called weekly by their assigned supervisor. They were checked in on. If they still needed things from us as far as food, we were able to do that. So they still received the case management that they needed to, just because you were in a shelter, in a family's member's home or you're in a hotel, you still need to find your own place. You still needed to get out, you want to be self-sufficient. So this was just a Band-Aid because of COVID, having to keep that social distancing in the shelter. But it was still business as usual for us, regardless of where that family member was at the time.
Thank you, Nadine. And yes, thank you for checking the chat box. There's different levels of housing interventions that are available to people that are experiencing a housing crisis. So it might be that a family just needs one-time you know, quick financial assistance, maybe some really brief case management, and that might be the thing that helps to resolve their housing crisis. But it might be that they need a greater intervention, and if they enter an emergency shelter, that's where they would find that greater level of help.
Yeah.
I believe here like 4. Go ahead.
No, I was just going to say, and also just utilizing and helping families, and it's a huge tool to help families and individuals
Seems like as long as Gage will stay with Mason.
Hello? Sorry. But it seems like it's also really helpful to, you know, provide those those resources such as that 211 website. And I know I was talking about it yesterday, but that is a great resource to help equip families and individuals with what is available in the community as well. And helping, you know, families and singles or families in particular that may have that urgent need at that moment to really access resources and remember what resources that they might have used before. And at least if they can remember that website, they can know that there may be some COVID related relief or some COVID related resources that are there, but kind of just installing that skill of here are access to some resources that you can really tap into and, you know, kind of help people feel confident in those resources and what they've used before. So even though we're going through a pandemic right now, but really, you know, laying out what are the next steps that you can take to kind of self-sustain yourself or to refer back to help kind of house yourself in what way. So empowering, you know, if anything, with resources.
Thank you, Bobby. Yeah, so reflecting back on what you're just saying, the 211 website, you can just log on and it will give you the resources that are available to you within your community, specific to your area. And that's a really great way to connect people to what they need in their own community. Thanks. So I want to turn the conversation now to what kind of difficulties you all are facing in helping families find stable housing. Maybe they've lost their own apartment and they're looking for somewhere new to go, trying to sign a new lease, find a new rental. And we all know that there is currently a moratorium on evictions that is extended now by the federal government through December. And how is that affecting the work that you're doing in the field in trying to help out families find landlords that are willing to rent to them?
I can jump in. In our rapid rehousing program, we are really struggling, just almost like the competition. There's more competition out there. So when we have families who put in for an apartment or they apply, it's, you know, they're up against so many more people right now. I think there's also, you know, these added barriers, which have always been barriers, you know, low to no income because we're in, you know, a low barrier program. Evictions, they have evictions on their record. So you're already coming in with some, you know, where a landlord might be hesitant. So where we've always had that, but now we just have this added piece of the competition. So it's almost like, you know, it's this landlord market where they have more people that they can choose from. So we're finding that instead of taking 30 days where we can, you know, you look at 3 or 4 units, our families are looking at 10, 12, 15 units because the market is just that much more difficult to try to find something.
One of the things that I also wanted to add when it deals with being able to find a landlord as well, it has been kind of challenging, but I think that this is where the collaboration, I guess, might come in, is also being able to speak with the landlords one-on-one to try to give them a little bit of history on the client. I know that that has been beneficial, not for all landlords, but it has is something that has worked in the past, as opposed to just the client sort of like doing it themselves. I think that when we work together with the client, contact the landlords, we're kind of like upfront as far as what the barriers that the client has, whether it deals with like eviction or anything of that nature. I think it has been beneficial to us during this time to really have like an open dialogue with the landlord. And like I said, sometimes it has worked, sometimes, you know, it hasn't, but it's because it's, there are so many people in need, but yet the inventory, if you will, is so low because everybody's trying to get that one apartment. So we have more people than we actually have apartments to place them in. So I think having honest conversations with the landlords has been something that has been helpful at times as well.
Yeah, thank you.
And for us at Spooner House, you know, we haven't had any major issues with housing families. We are in the Valley, so we're surrounded by two major towns, which is Fairfield County, Bridgeport, and we have New Haven. So we're really not having issues in regards to finding landlords. People just want to live in certain areas, which will, you know, and if there's not a unit there, it's just a strategic, just kind of waiting around to see what opens up in that area. But we've been pretty lucky being surrounded by two towns that they do have a lot of housing options in the two towns. So knock on wood, during the pandemic, COVID, we housed 3 families, which I think is pretty good.
Great.
That's great, Nadine. Thank you. I think something that I've seen in the field pre-pandemic was that for families that maybe have an eviction on their record already, a landlord will request maybe a double security deposit in order to kind of mitigate that and get past that. Is that something that you're all seeing landlords asking for greater dollars upfront in order to rent to some of our folks?
Yeah, definitely. I know another thing that we're also seeing is just the amount of income that, you know, some low-income families may have. You know, landlords are looking for their income to be maybe, you know, 2 times more than what the rent is. It's like really kind of like that. Some of the, you know, financial requirements, or, you know, that what the landlord is looking for is for a client to have a lot of income, and we're working with families that have fixed income, and really just kind of getting, you know, the application through the door to at least kind of see the apartment, go through the inspection, and really kind of talk with the landlord about, you know, just you kind of laying out a plan. You know, some landlords are just, if you don't have a certain amount of income, you know, to cover, you know, 2 or 3 months of rent, then there's a lot of denials on that end. But yes, they are charging double security deposits just to secure.
Diana, again, there's a question here from Samantha Parker, and I think it's more, I don't know, for Annie. It says, are clients reporting they're homeless because landlords requested sexual favors in exchange for rent?
You know what? I honestly don't know that I could answer that accurately, but I do know that nationally, I mean, we are seeing a rise in landlords. I mean, people are much more vulnerable than they were in the past. So if you already are in a vulnerable situation and you have a landlord that maybe isn't the most upstanding, you know, I mean, I always have to say that we work with the most amazing landlords. Whenever I see something bad about a landlord, I always want to add that we also have amazing landlords in Connecticut that do work with us. But I think on the rise nationally, we are seeing more landlords that are taking advantage of situations and sort of off, you know, I'll give you a break on this if you do that. So it's really, and it's, those are tough situations to be able to document and, you know, fight for, but it's really important to be aware of that and to know that that's not okay. And people should reach out for help if they're finding that is happening.
And there are like 3 questions here regarding security deposits being a problem. So while I'm unmuted, for Spooner House, one of our requirements being in shelter is we have a savings program. So they have to save at least 60% of their income, regardless of where that income comes from. For cases of an apartment, it is tough. You know, you're fighting, you know, we're one agency within a can, you know, all trying to monopolize, you know, a certain pool of money. But for us, if, you know, it's a better feeling if the resident is able to say, I have this money in savings. I don't have to wait for a rapid rehousing check, or I have the money to take care of this. Because sometimes these apartments, you have to jump on them quickly, and you can't just wait for, you know, a lot of the paperwork. So for us, we hit hard on savings. We do a lot in-house, so the person does not have to spend their money, and it works. And they feel good when they see that report every month to how much money they saved, and it starts changing their outlook. It puts the fire under them to look for more places.
I think that's a great point, in that for people that are income on the poverty level, that saving up for a security deposit can be really difficult. And there are resources out there, and the way to access them would be that initial call to 211 and getting an assessment for housing services.
Diana, I also wanted to piggyback off what was said in regards to the savings, because that's something that we're encouraging here as well at St. Vincent de Paul, to be able to encourage the residents, especially those that have income from wherever the source is coming from, to try to save as much as possible. So, and of course, it's going to be to have those discussions as far as housing. So then that way, I mean, one of the things that we are trying to test out here is if, for example, we can get, you know, a resident with, for example, the security deposit and the first month's rent with like the rapid exit. And we are having conversations with the landlords, and the landlords are kind of like bargaining, you know, a little bit here and there, that we can say with some of the money that the resident has also saved on their own, where we can say, well, we can, you know, right off the bat, we can have, for example, the 2 security deposits, if that's what the landlord is asking for, the first month's rent through the program, but yet we can even probably do a second month rent right from the beginning with the savings that the client has done while being in the shelter. So it's also, yeah, just thinking of another way on how to be able to house, you know, residents kind of like outside of the box.
And this is Felicity Ellis from MMW CAN. I'm the coordinator for our region, and I think just to piggyback off of what Christine shared, that, you know, as a state and as CAN leaders, we're all looking at what are the other options to try to help, you know, promote good relationships with landlords. And so we are working in close collaboration with the Department of Housing to develop a landlord incentive program where first-time landlords coming into a relationship with any CAN will have the opportunity to get some type of incentive payment. So more to come on that. Not exactly a spoiler alert, but just a little like plug. I think some of the questions in the comments have been related to security deposits. So sometimes it's about assistance for paying for that security deposit, but sometimes it's also, you know, an additional financial incentive for the landlord. So we are working to develop some of that. Again, more to come, details to be shared later, but definitely looking to be as creative as possible, because we know the safest place for everybody in general is a home, and definitely in a pandemic, that's the safest place for families. So.
Yeah, and I forgot to add in New Haven County, what we've done, we have a landlord engagement, and we invite all the landlords to like a small breakfast and just, you know, talk about what we still can offer that client once that client is now in that unit or in their own apartment. We will still be able to do some case management, you know, for a couple of months, maybe an entire year, and they get to see that we haven't just put that client in that apartment and forgot about them. So it's good, you know, and once they see the success in that and they have another unit, more than likely they'll tend to let you know that that another unit's available, because they know they're getting that hands-on from the team until we kind of like gradually moved out from that family's life.
Thank you, Nadine. And Felicity as well. And I think it's really important to note that when we're trying to help families keep them from having to go to an emergency shelter, that finding a new landlord is not always the solution. And really being able to have these conversations with families, with the head of household, to work through a problem solving, creative thinking, solutions, can be the thing that helps, maybe not financially, but working through a problem solving conversation to help families find stability in housing. And so what are you guys seeing, within the field when it's not financials that is helpful? What other solutions are we coming up with?
I've seen situations where the person has saved enough money to pay for security deposit and first month's rent. They have the problem talking to the landlord, explaining that I can go forward, I have evictions, but if they get letters from their past landlords that, they've been outstanding tenants for this many months, they're fine. Even finding apartments or finding landlords who are willing to work with them, sometimes they can't, they look online, but they can't communicate with them. If we have landlords who are willing to work in the past, and we can get them set up, like, I know someone from this town, please contact them. I know someone from this town, contact them. If they can do that and just give them the resource who to contact, and they can go forward from there.
Thank you, Tricia. I think it's also important to note for families that are either on the brink of homelessness or experiencing homelessness that the stress of their housing crisis can be a trauma to not only to themselves, but to their children. And what are we all seeing in the field as far as that trauma and the experience of homelessness for families?
Hi, it's me again. We were just talking about this last week. We're so focused on the adults in the family, we don't think about the children in the family sometimes, and what are they feeling. So we are still connected to our social support networks in the area that are still doing virtual sessions, and they're doing them with the kids too, if the kids need it. So for the mental health piece, the entire family is still receiving those services through Zoom. It's a whole different, baby now because of COVID, but we still wanted to make that available, and those mental health providers still wanted to provide that service. So the kids are adapting as best they can. It's hard, trying to, again, do that online learning before we hit the summer. It was that online learning piece, making sure they had the space to do the learning and the tools to do it. So we were all learning. And we tend to ask the kids, is there anything that we can do for you at Spooner House? Are you okay? Do you need anything? And I think if, for the most part, they see that their families are okay, they're okay. Kids are more resilient than, adults. So, again, if I had wood, I would knock on it. It wasn't bad. And by being with other kids makes it easier too, still having that support, the friendships, and able to play at the end of the day.
We've tapped a lot into social service. So we're not that far from a park with a pool. So we've been getting free passes for the pools, checking into what sports were available this summer, training camps for football. We have a young guy who's, he's definitely a football guy. So just kind of encouraging those signups and just to keep going with some sense of what normalcy used to be. And then same thing, piggyback on that, the school, making sure that the Wi-Fi reaches everywhere. One thing we didn't think of was we have a teenager who was really concerned about what the background looked like in his computer. And he didn't want to have the shelter walls or lockers or what have you. And so we found him a quiet area with kind of a homey feel to it. And that really kind of settled him down. So what's in the background, who's around, but finding just some quiet area and having that conversation. What are you feeling? What are you thinking? What is agitating you? And let's see what we can do to fix it, But that comes with it comes with conversation, and it comes with the interaction, not just with the parents who have children. Exactly, it's having that relationship with the kids, with the parents there, but having that relationship with the kids so they can tell you what's on their mind. Because a lot of times it's been just that quick fix, that quick shift to make life more tolerable. We have bikes here, so the kids can take bikes and get away from the shelter really quickly. That's been a real stigma for them, is having people see them walk out of the shelter. So they hop on a bike and off they head out to meet up with their friends, etc.
So from a diversion standpoint, I've seen that a lot of schools have actually kind of taken initiative, and I've noticed that a lot of kids have either counselors that are following up with them, whether they're in hotel or kind of, going from home to home. And I've also tried to refer them to any of the resources that we have in the area, so they can get connected with mental health if that's something that they feel that they need.
Thank you, Monica. And that kind of brings our conversation to the next topic. Unless somebody else
Diana,
has something else to share. Go ahead.
Yeah, I think because you see your questions are all geared to kids now in this little box. So has anyone, I guess, worked with Head Start or Birth to 3, I guess, during the pandemic? I guess that's what they're asking.
Okay.
And that was it for that particular question.
Thank you, Nadine. Thoughts? Head Start and Birth to 3, how is that working for families these days?
So I still keep in contact with the Head Start worker at TCA on a weekly or a monthly basis on clients that I have screened. So I always talk to them if they're in this Head Start program, if they're willing to be a part of this Head Start program. If they are, I'll fill out an application for the client and email it over to the Head Start worker at TCA every week or every month. And then they will get in contact for any additional support that the family might need for that family.
Thank you, Tricia.
I'd like to, may I add, Diana, I just want to throw in, this isn't specific to Head Start or Birth to 3, but just in general, the DV system, we've always been very cautious about, can we call this number? Is this a safe number to call? When can we call? But with people being in quarantine or being remote, it's really changed the way people receive services or able to receive services. So for example, in housing, we've had some delays in finding apartments because where someone had respite because their abuser was at work all day, that was when they could, get their safety plan together and when they could, start looking for apartments. But when you have an abuser who's working from home and your kids are home, it really changes the dynamic of how do you help someone, whether you're talking about the support services or the housing. It's created a barrier for a lot of our families because you can't provide services. You can't just pick up a phone and call them. I mean, you have to be really cautious and careful about when you call, where you call. They have to be careful. And I would say that in the DV system, but also in the housing system. I mean, we have families who they have to teach their kids during the day, right? They don't have the time that they used to, or they can't fill up and have Zoom appointments all day, every day, and then teach the kids. And I mean, I just think in general, I don't really have a solution here, but I just think it's changed the dynamic of how to offer services and what services to offer. So really, even we try our best to do telehealth and offer services via Zoom, which is what I'm hearing other people are doing. And that's great, but you can't always do that because sometimes the person can't be on a Zoom call with their DV counselor when their abuser is in the same 1-bedroom apartment as they are. So it's just a change of dynamic and being creative and, when do you call? How do you call? Who do you say you are? Like just the whole dynamic of how we work has changed, really.
I think that's a really great point, Annie. Thank you. And even just within the 211 call, for those that are experiencing a housing crisis and calling into 211 and getting an assessment, that most of those assessments are happening via phone these days. And that changes the dynamic of our work, absolutely. So lastly, I'd like to speak about the experiences of those families that cannot remain doubled up for whatever reason, can't couch surf any longer, are at that point of needing emergency shelter, and that is their last resort, and they have to enter shelter. Shelters being a congregate setting, how is that working for folks in working through being able to social distance in the shelter setting, and how does that work for families? What are your shelters look like these days?
So here we have, again, minimize some of our numbers. One of the positive things about being a family is you're your own nucleus. So social distancing within the family doesn't have to be prevalent. And it is social distancing with the other guest or residents who are here. So we have a family room. We also have a mother-child or mother-children room. And we have partitions in that mother-children room between families. Again, so within their area, they are their own nucleus. One of the hard parts, I think, is the kids in masks. But you know, we found other areas to play. So the summer it's been okay because people can go outside. I was looking the other night, and there was a hallway that was a little bit obscure, and so mom and the kids were playing in the hallway rather than being in that room. They were able to go ahead and you know, blow off a little bit of steam. So it's also dinner time. Again, being your family nucleus there, they can sit down at a table and have meals together kind of as a norm, and then social distancing from the others who are at other tables. So I think it's been a little bit easier on the families than it has been our residents who need to stay socially distanced from one another. At least the family unit almost in an odd way stays intact.
Hi, and for us at Spooner House, not only are we a family shelter, we're an individual shelter. So we have 36 beds. So it was us going upstairs and kind of, you know, this is one bed, let's social distance, let's do the 6 feet or more, empty those beds. And we did that and we just moved people around. Again, of course, the hotel played a big part in being able to send families to friends or relatives. As far as dinner, we cut dinner time into 2 different shifts. So we'll have one shift we'll do, you know, based on your last name, sort of like what they did for school. And then we have the second shift. You had to wear your mask, smoke breaks. It was all about social distancing for us. And it worked. Each person was able to have their own table to eat dinner. And we just learned how to move with, you know, through the new norm in the shelter. So we weren't seeing a real big increase in shelter intake. So that also kept us at a good social distance separation.
Thank you, Nadine. And I think that's important to note that many people who might not understand the emergency shelter system or have misconceptions, that many of our family shelters across the state also have individuals that need to come in to a dormitory kind of setting, but under the same house, under the same roof as our family shelter setting.
Yeah, and what we also did, we had an extra room, and we made that like the quarantine room. So if someone did get COVID while they were in shelter, they were able to self-isolate, and that was their room. You know, thankfully we didn't have COVID come through the shelter, but we also made accommodations just in case, you know, because if you're in the shelter, that means you had nowhere else to go. So we want to make sure that just because you had COVID, and we reassured them, if you did get COVID, we weren't going to put you out unless you had to stay at the hospital for, you know, whatever. But we put all safety precautions in place, and and including staff, you know, everyone still has to wear their mask inside. We limited indoor people coming in for donations, you know, leave them outside at the door. But we really kind of went through A to Z to make sure not only staff was safe, but the residents as well.
Thank you. And I think it's really important to note as well that we tried to help families get out of shelter and find stable housing as quickly as possible. How long on average are you finding that families end up having to stay with you?
You meaning staying in shelter versus finding their own place?
Correct.
Not long. We're still business as usual. We never closed. We are still, you know, looking for apartments. They're still seeing their supervisor one-on-one. I mean, it's business as usual. We've limited, as I said, a lot of the influx of people coming in, and we've limited their time out unless they're going to look for an apartment or go to work. But we're still trying to stay on that 45-day range of getting people in shelter and out. So,
Ours is, sorry. Ours has been a little bit longer, and that comes back to the landlord and moratoriums. So it's, you know, we're also business as usual with case managers, et cetera, but finding suitable housing. And again, it comes down to recent eviction rates. The landlords are less willing to go ahead and take people on. So services are the same, if not beefed up a little bit more. We've got some new staff here, some fantastic staff. But it really comes down to availability of unit. And so we're trying to get creative.
someone asked a question, and I was trying to think about it. Someone said, is transitional housing still available in Connecticut for families? It's a problem where they are, and is there some help to get to transitional housing?
I can speak to that. I think that across the state that we've refocused our financial resources. So instead of putting a family into a transitional housing program, our resources now are housing focused. So what would have been in the past funding available to run a transitional housing program, that those resources now are focused on providing rental assistance and case management to get people into their own stable housing instead.
I guess it's all, and someone, what are we doing about our elderly population? That was the question. I'm not sure, you know.
Yeah, I'm not really sure how that relates specifically to families.
Yeah.
Now, you know, we may have more multi-generational families that are intact, where there's a grandmother or a grandfather that's within the family unit. There are some specific resources available to those that are elderly, elderly protective services. You know, specifically what comes to mind is that the federal law that the landlord can't ask for more than 2 security deposits for somebody that's over 62. So there are those kind of protections in place. And again, I think that, you know, we recognize that there may be some more multi-generational families that are more intact than would have been pre-pandemic. I think that there are some other questions here in the chat box that I want to make sure that we have a chance to address. One specifically regarding shelters accommodating emotional support animals.
We haven't seen a need for that. I don't even think we have been asked. So we do. Case by case, you know, as long as all the paperwork is in place for that, you know, you'll find that people have pets that they love, and, you know, they'll say that pet is an emotional support animal. But everything needs to be in place for us to consider that. If it's just a pet, there is a local, I guess, veterinarian type of agency in Fairfield that will look at the animal, take the animals while the family's in shelter.
So making that distinction between an emotional support animal versus a service animal.
Mm-hmm. Right. And also, you know, also considering if someone has an income, to utilize, you know, their income to house themselves, you know, with their pet, right? So that they don't have any, you know, any questions about where their pet's going to go. Their pet can be housed with them, whether it's a room for rent. You know, some hotel rooms, they do have a pet fee, but, you know, they would allow that pet to come in with them. But also as an incentive, maybe let's look together to get you housed in your apartment so you can be with your own, with your pets as well. And, you know, if we can provide some resources or some landlord contacts, we try to give that as well, but definitely incentive.
And someone mentioned, are we delivering meals to families? What they're doing in Minneapolis, they're delivering meals to rooms. Are we doing that here in Connecticut? Well, while they were in shelter, they were fed. Meals were delivered when they were, I'm sorry, not shelter, in the hotel. Meals were delivered 3 times for the day, which would cover their breakfast, lunch, and dinner. When you're in the shelter, we provide the meals. So clients were always able to eat. They were fed well. And I hope that answered the question. I don't know if anyone else had a different response.
Well, I know we do here in our region. We work with St. Vincent's de Paul and with other community agencies to help provide meals to clients that may have been are in the hotels, or if they need some resources, just some access to meals. We definitely have a network that we communicate with to make sure that people are at least, you know, having access to food and meals during this pandemic. And we also have a lot of food pantries that are in the community as well that we refer to, just to help people with their food cost.
So we're running a little, we've got a few more minutes here on this webinar, and I want to address, looking at a few more of these questions in the chat box. A couple of them are surrounding those that are undocumented or dealing with immigration issues. I'm wondering if any of you can speak to that. Are you seeing many of those cases where a family might not be documented, and are they able to enter shelter, and what kind of services are available to those people as well?
Well, I mean, if you're homeless, I mean, if you're undocumented, we still will look at you. You know, services, you still need the service. We haven't had, I can't even recall on my years at Spooner House, even having to deal with maybe 1 or 2. But they do have family, and we're big on reunification. So it's hard to, I really can't answer that question because I really haven't seen it too.
That's good, though. Thank you, Nadine.
I can say that we've worked with some families who are undocumented, and the struggle is really the same for a lot of folks, but some issues that come up is just, some undocumented families were not getting the stimulus money that other folks were getting to help them. So getting laid off, but not having access to resources, or, no access to unemployment, no access to the stimulus money. And a lot of families, if you're undocumented, you may have housing, but maybe you're already doubled up, or you may be living in a place that, even if we are able to provide rental assistance to you, you might not be staying somewhere with a landlord who's like, oh yeah, here's my Social Security, here's my employee identification number, here's my W-9, so you guys can document that, right? Because for all these assistance programs, you need to provide a W-9. So it gets more difficult when you're not living in a situation where you can't provide a W-9, or you don't have access, your living situation just may be a little different. So, I mean, I think probably everyone's experienced the same thing, but we just find that there's that added hurdle, and there's, when you do lose the income, a lot of the families aren't getting unemployment. They're not getting stimulus money. So it's just, where do you find those resources that exist for the other folks who are dealing with COVID but have these resources?
And going back to undocumented, we haven't seen the need for shelter, but we've seen the need for food. Families they're not able to feed their families because they're not getting food stamps. And so our increase became in our food bank. We also have a food bank. So we saw a lot of increase in that in regard, families needing food. And it doesn't matter if you're documented or not, you need food, you need food. So we service those families.
You've seen an uptick in food insecurity.
In the food, yes. And one woman just, she was afraid to give any information. I just need a name, what town you reside in, come get your food. And, it's nice to hear, thank you guys, you're saving lives just based on the food. So I guess housing was okay. It was just the food was the issue.
I just also wanted to add, when it deals with undocumented, as they were saying before, I mean, when it deals with the services, I mean, we provide services, whether you are, of course, documented or undocumented, whether it's food, whether it's at the shelter. Another thing that we do have is that, and not necessarily as the only solution, but we also have programs that, depending, we don't have a lot of them, and maybe that might be for a different discussion, but there are programs that will take, or actually will look at, if a person is undocumented, they can still bring them into the program. So I know that when we go, like, for example, to like the housing solutions meetings, and we are dealing with like matching of certain clients, I mean, that's one of the things that we also look at, whether the client is documented or undocumented, to try to use to be able to give that person that is undocumented the right resource to housing. So, I mean, and again, there's not a lot of many, there's not many programs for those, but there is, because we've been able to do that in the past as far as housing and undocumented clients.
Thank you, Jessica. So we've got 2 minutes left, and I just want to take the time to thank all of you wonderful, hardworking people for doing all that you do day to day to help our families in Connecticut stay stably housed or find stable housing. It's not easy work, but you all are doing a bang-up job. So it doesn't go unnoticed, and thank you all for all that you do. I will add that there is a 4 o'clock call today that we have a little bit of a surprise. So I know Madeline had mentioned that at the beginning of the call today, and I'm hoping that you all will be able to join us for that as well. Thank you for registering for the ATI, and I hope that you'll be able to join us for many of our other workshops throughout the week. So thanks a lot.
Thanks, Diana.
Thank you.
Thank you.
Thanks, Diana.
Thanks. I hope you all have a great rest of your day.
You too.